Welcome to Michigan Medicine's von Voigtlander Women's Hospital. Each year, our team of world-class doctors, midwives, and nurses help deliver approximately 4,800 babies in our birth center. When you are in labor and arrive at the hospital, please use our valet parking services located at the front entrance. Valet parking is open 24 hours a day, 7 days a week, and is free for the first 24 hours. After 24 hours, you will be charged a small fee, so you may choose to move your car to one of our parking structures. Parking structure P4 is a good option for your visitors, or if you decide to move your car from valet parking. But it does fill up quickly. If P4 is full, please use parking structures P2 and P3. There are signs that direct you from the parking structures to C.S. Mott Children's Hospital and von Voigtlander Women's Hospital. Patients can have their parking tickets stamped at the welcome desks on the second and third floors to receive a discounted rate. When you think you might be in labor, please call 734-764-8134 before your arrival, if possible. This will help the staff prepare for your arrival. The front entrance to the hospital is staffed by entrance services and guest services. Upon your arrival, an entrance services attendant or guest services specialist will welcome you and provide you with a wheelchair-assisted escort if needed. Before you head upstairs, you will make a quick stop at the welcome desk to check in with a guest services specialist. They will conduct a brief health screen on you and anyone accompanying you to the birth center. Once you have answered their questions, they will give you a sticker and send you on your way. When you arrive at the birth center triage on the 9th floor of von Voigtlander Women's Hospital, you'll notice guest services are also here. They are located at all hospital entrances on each of the 6 inpatient floors. Once you have checked in, you will head to one of our private rooms, where your labor will be evaluated by a nurse and a certified nurse midwife. We'll then make a decision together about whether it's time to be admitted. Once you have been admitted, you will be escorted to a room in the birth center. If you have a birth plan or a birth partnership form that you have discussed with your healthcare provider, you should share it with the nursing staff at this time. If you are having a cesarean birth, the surgical suites are also located on the 9th floor. Von Voigtlander Women's Hospital has 50 private patient rooms. Each room has a private bathroom with a shower, a couch or a chair that converts to a sleep space for one person to spend the night with you, a mini refrigerator for snacks and beverages, Wi-Fi, room phones, and a TV equipped with an on-demand entertainment and education system called the Get Well Network. We do not include a phone charger, so please remember to bring yours. 8 of our rooms are equipped with bathtubs for laboring. If you are interested in a tub room, talk to your healthcare provider about it and put it in your birth plan or birth partnership form. Most importantly, when you are being admitted for labor, let the triage nurse know that you would like to use a tub. Your birth experience is unique to what you need. While you are in labor, you can walk the halls, rest in your room, or utilize our birthing support tools, including birthing balls, birth bars, and mirrors. Once a laboring mom has been admitted to her room, all visitors over the age of 16 will be badged. Visiting hours are generally 9 a.m. to 9 p.m. All visitors are required to have photo identification and will receive a brief health screen. If you have family members or friends who are sick, please advise them not to visit the hospital. You can customize your visitor experience. We typically allow a maximum of 4 support people in your room during birth, but we can discuss exceptions. If you would like to prevent someone from visiting you, please speak with the guest services specialist to develop a visiting plan. There are waiting areas throughout the birth center to accommodate visitors and keep the hallways open. Please keep in mind that there is only room for one person to stay overnight with you, which we encourage. For cesarean births, your family and friends are encouraged to wait in the main waiting area located in the main lobby on the second floor. They will be given a pager that will alert them when you are out of surgery and ready for visitors. Von Voigtlander Women's Hospital practices a philosophy of no separation of mother, family, and new baby whenever possible. We do not have a nursery for newborns. Babies room in, which provides optimal time to learn to be a family with the support of our staff. Babies receive ID bands at birth that include their unique registration number along with mom's name. Moms and babies both wear security transmitter bands that are matched to ensure that babies are not separated from their moms. If they are separated or if the transmitter is removed or covered, a non-harmful radio frequency goes off and the elevators and doors to the stairwells lock. If baby needs specialized care, they may be brought to the Brandon Newborn Intensive Care Unit. The NICU is located directly below the birth center on the 8th floor of the hospital. The NICU is staffed with nationally recognized neonatologists, nurse practitioners, physician's assistants, and highly trained nurses who will provide your baby with excellent care. The NICU has private rooms and accommodations that allow you to stay with your baby. If your baby is in the NICU while you are recovering in the birth center, our staff will work to get you to the NICU to be with your baby when you are medically ready. We offer room service with a menu that features a variety of healthy items that can be ordered and delivered to your room. Specialized diet menus are available, so please let your nurse know if you need one. Support persons and guests can also order a meal for a small charge that will be added to your bill. There are also several nutrition rooms throughout the birth center that offer water, coffee, and light snacks, as well as several cafe options throughout the hospital complex. There are many amenities throughout the hospital to keep you and your support people engaged in other ways. After the birth of your baby, you will generally spend 24 hours recovering in the hospital if you have a vaginal birth, and 48 hours recovering in the hospital if you have a cesarean birth. When it's time to finally leave, we will ensure that you and your baby are prepared for the trip home. Support continues after you have left as well. You will schedule an appointment with your baby's healthcare provider during the first few days at home, and depending on where you live, you may be offered an in-home visit. We hope that this video has answered many of the questions you have about our birth center. If you have any additional questions about our facility, please call 734-936-8886.